Have you ever found yourself pausing, perhaps in a quiet moment, and wondering how the journey of aging truly shapes your intimate life, your desires, and even your personal pleasure? As we gracefully enter our 70s, 80s, and beyond, it's entirely natural for many of us to grapple with profound questions about intimacy, connection, and joy. This often includes topics like masturbation, a subject too frequently shrouded in whispers and misunderstanding, yet one that remains a perfectly natural, healthy, and vital part of human sexuality, no matter how many years we've accumulated. The truth is, your capacity for pleasure doesn't simply vanish with age, and ignoring this fundamental aspect of yourself could mean missing out on significant well-being. Today, we're embarking on an illuminating journey to uncover 8 essential insights that every older adult deserves to know about this deeply personal facet of life. We'll carefully explore the remarkable physical changes our bodies undergo, the intricate emotional landscapes that can arise, and the often outdated societal perceptions that stubbornly cling to sexual expression in our golden years. Gaining a comprehensive understanding of these aspects isn't just important, it's absolutely crucial for cultivating a healthy, affirming relationship with your own body and your deepest desires. But why should you stay with us until the very end? Because by the time this video concludes, you'll be armed with expert tips on not only how to adapt gracefully to these changes, but also how to joyfully explore new methods for enhancing your pleasure, ultimately empowering you to embrace your sexuality in a way that feels genuinely fulfilling and deeply empowering. Whether you're personally navigating these intriguing challenges or compassionately supporting someone who is, this discussion will equip you with the knowledge and the unwavering confidence to truly savor and enjoy this rich facet of life to its fullest. So, let's begin this profoundly important and liberating journey together. As we gracefully advance in years, our bodies undergo a series of significant physiological transformations that profoundly influence our overall health, hormone levels, and fundamental physical functioning. This intricate process of aging often involves a gradual and natural decline in the efficiency of bodily systems that once operated with seamless ease in our youth. Among the myriad of shifts, changes in hormone production play a particularly pivotal role, impacting both men and women in ways that can affect sexual health, pleasure, and overall well-being. For men, the natural and steady decrease in testosterone levels typically commences in their late 30s or early 40s and continues progressively throughout the rest of their lives. Testosterone, a crucial hormone essential for sexual desire and the maintenance of erectile function, diminishes at an approximate rate of 1% per year. Consequently, many older men often observe a reduction in their libido or sexual drive, which can lead to sexual pleasure becoming less frequent or intense. This decline in testosterone can also make it more challenging to achieve or sustain an erection, a common condition known as erectile dysfunction, which can further impact sexual activity and sometimes contribute to feelings of frustration or decreased self-esteem. Women experience equally complex changes, primarily with the onset of menopause, typically occurring between the ages of 45 and 55. This brings about a dramatic drop in the levels of estrogen and progesterone, hormones that are vital for maintaining vaginal health and sexual function. A decrease in estrogen often leads to the thinning of the vaginal walls, reduced elasticity, and diminished natural lubrication, collectively resulting in vaginal dryness. This dryness can cause discomfort or even pain during any sexual activity, including masturbation or intercourse, making these experiences less pleasurable. Additionally, some women may report a decrease in clitoral sensitivity, further impacting sexual satisfaction. Beyond these hormonal fluctuations, both sexes also experience physical changes affecting circulation and muscle function, which are integral to sexual pleasure. With age, blood flow throughout the body can become less efficient, specifically the genital areas, which rely on robust blood circulation for arousal, may not receive as much blood flow as they did in younger years. This reduction can make the experience of arousal or orgasm less intense, or simply more difficult to attain. Furthermore, aging frequently brings a decline in muscle tone, including the crucial pelvic floor muscles, which are involved in sexual function. Weakened pelvic muscles can lead to reduced control over sexual responses and diminished sensation. It's also imperative to acknowledge the significant psychological impacts these physical changes can have. For many, These bodily shifts can trigger anxiety, embarrassment, or profound feelings of inadequacy, which in turn can further exacerbate sexual difficulties. Understanding these physiological transformations is indeed the first vital step toward addressing them effectively, as modern advancements in sexual health now offer various therapies, exercises, and medical treatments designed to help individuals maintain a fulfilling sexual life well into their later years. While masturbation is universally regarded as a generally safe and natural activity that offers substantial physical and psychological benefits, older adults must be particularly mindful of potential health risks associated with age-related changes and any pre-existing medical conditions. As the body matures, it can become more vulnerable to strain or complications from physical exertion, even during solo sexual activities. For example, individuals managing cardiovascular disease or who have a history of heart-related conditions should always exercise caution. Sexual arousal and physical exertion can temporarily elevate heart rate and blood pressure, potentially placing undue strain on the cardiovascular system. It is crucial for these individuals to regularly monitor their heart health and consult with a healthcare provider if they experience any concerning symptoms such as chest pain, dizziness, or shortness of breath during or after sexual activity. Similarly, for those who contend with arthritis or other joint-related issues, certain positions or repetitive movements during self-pleasure might inadvertently exacerbate joint pain or inflammation. Older adults should pay close attention to how different positions or actions impact their personal comfort and overall mobility. Simple adjustments, such as using supportive cushions or experimenting with gentler techniques, can significantly help minimize discomfort and reduce the risk of joint strain. Moreover, many older adults take various medications for chronic illnesses like high blood pressure, diabetes, or depression. These medications can, at times, interfere with sexual function, potentially leading to reduced libido, difficulties achieving or maintaining arousal, or even delayed orgasm. It is extremely important to be fully aware of the potential side effects of your medications and to discuss any concerns openly with your healthcare provider, who may be able to adjust dosages or recommend alternative treatments specifically designed to improve your sexual well-being. Furthermore, certain health conditions such as diabetes can directly impact nerve sensitivity, making sexual pleasure less intense or harder to achieve. Keeping all these factors in mind, older adults should approach sexual activities with a balanced mindset of patience and profound self-awareness, always acknowledging that modifications might be necessary for both safety and utmost satisfaction. Being thoroughly informed and proactive about your health can ensure that masturbation remains a positive, safe, and truly enriching aspect of your life as you continue to age. Sexual expression, including the deeply personal act of self-pleasure, such as masturbation, offers remarkable benefits for one's mental and emotional well-being. Engaging in sexual activities triggers the release of powerful feel-good hormones like endorphins and oxytocin, which are incredibly effective at alleviating stress, significantly enhancing mood, and promoting an overarching sense of relaxation and well-being. For older adults who may face unique stressors such as health concerns, feelings of loneliness, or a diminished sense of purpose, this natural release of tension can be especially therapeutic, contributing profoundly to a greater sense of personal happiness and emotional balance. Despite these undeniable benefits, many older adults frequently encounter feelings of guilt, shame, or discomfort when it comes to sexual activities. These pervasive negative emotions often originate from ingrained societal stigmas or deeply outdated cultural beliefs that mistakenly portray sexuality in aging populations as inappropriate, irrelevant, or even taboo. Furthermore, some individuals may have internalized messages throughout their lives that erroneously equate sexual pleasure with immorality or weakness, leading to deeply rooted feelings of embarrassment or self-judgment when they engage in or simply desire sexual expression. Such emotional barriers can cause considerable distress, potentially impacting self-esteem and overall mental health if left unaddressed. Shame and guilt surrounding sexuality can foster feelings of isolation or create an unnecessary burden of emotional pain, ultimately diminishing one's quality of life. This is precisely why it is paramount to foster open, supportive conversations about sexual health and aging. Education and widespread awareness are powerful tools that can help dispel myths, significantly reduce stigma, and affirm that sexual desire and expression are unequivocally normal and healthy parts of life at any age. Healthcare professionals and supportive communities play a vital role in advancing this understanding, providing safe spaces and offering compassionate guidance to help older adults embrace their sexual identities without fear or shame. Encouraging an honest dialogue about sexual well-being can empower older adults to experience intimacy, whether shared with a partner or through solitary self-exploration, in ways that profoundly enhance their mental and emotional health. Ultimately, recognizing and respecting the fundamental significance of sexual health in the aging process creates a more inclusive, understanding, and supportive environment for people to age with inherent dignity and profound joy. Social isolation and pervasive loneliness are increasingly prevalent challenges among older adults, significantly impacting not only their mental and emotional well-being, but also various aspects of their physical and sexual health. As people age, major life transitions such as retirement, the profound loss of loved ones, or reduced physical mobility can often trigger profound feelings of isolation, causing individuals to gradually withdraw from their social circles or become disconnected from once supportive networks. The deep sense of loneliness that frequently accompanies these experiences can drive individuals to focus more heavily on solitary activities as a coping mechanism. One significant way in which loneliness manifests is through an increased emphasis on self-soothing behaviors, including masturbation. For many older adults, engaging in solitary sexual activities can provide a temporary yet vital sense of comfort, pleasure, and much-needed stress relief, which becomes particularly essential when meaningful social interactions are scarce. In this context, masturbation can genuinely serve as a healthy and natural response to isolation, helping to fulfill basic human needs for intimacy and physical release. However, while self-pleasure is undeniably beneficial and effective in reducing stress, it is crucial to recognize the broader picture of maintaining a truly healthy, well-rounded lifestyle. The key lies in finding balance. Relying solely on solitary activities as the primary form of self-care can sometimes inadvertently deepen feelings of isolation, making it even more challenging to reconnect with others or find deeper emotional fulfillment. Prolonged periods of loneliness may also contribute to a general decline in mental health, exacerbating existing issues like depression, anxiety, or a pervasive lack of motivation, thereby creating a vicious cycle of withdrawal and further isolation. To mitigate these pervasive challenges, it is absolutely crucial for older adults to actively seek out opportunities for social engagement, even if it initially feels difficult or daunting. Simple yet powerful actions such as joining community groups, participating in fitness classes specifically tailored to older adults, volunteering for causes they care about, or proactively reconnecting with family and friends can make a profoundly significant difference. Activities that foster genuine connection can dramatically help reduce feelings of loneliness, enrich one's emotional life, and even positively impact sexual health by reinvigorating a sense of self-worth and purpose. Moreover, communities and healthcare providers have a vital role to play in supporting older adults by actively creating spaces where they feel seen, heard, and genuinely valued. Initiatives like organized social events, supportive counseling groups, and comprehensive wellness programs can provide essential opportunities for connection building and nurturing meaningful relationships. This not only enriches the emotional and social aspects of life, but also encourages a more holistic approach to health where physical, emotional, and sexual well-being are all interconnected, mutually supportive, and deeply valued. Maintaining robust sexual health remains an integral component of overall well-being and quality of life as we age. For older adults who continue to be sexually active, open and honest communication with partners about desires, preferences, and any evolving needs becomes increasingly paramount. The aging process inevitably brings various physical and emotional changes that can affect sexual experiences, such as a reduced libido alterations in vaginal lubrication, or difficulties achieving or sustaining an erection. These shifts are entirely normal and a natural part of aging, but they can indeed create significant challenges within relationships if left unaddressed. Candidly discussing these changes can foster greater understanding, compassion, and deeper intimacy between partners. For instance, some older adults might discover that touching, kissing, or cuddling feels more profoundly rewarding and emotionally fulfilling than intercourse itself, while others may continue to enthusiastically enjoy a full range of sexual activities. Addressing these evolving preferences openly with your partner can significantly enhance both physical pleasure and emotional connection. Additionally, having honest conversations about masturbation can help partners clarify their individual needs, relieve sexual tension, and jointly discover new ways to find fulfillment, either individually or together. Sharing thoughts about personal sexual experiences or habits can also alleviate misunderstandings, dispel insecurities, and offer valuable insights into each other's unique sexual wellness. Another crucial consideration is the impact of aging on physical and sexual health. Conditions such as arthritis, diabetes, or cardiovascular issues may directly alter one's sexual capacity or stamina. Discussing these health concerns transparently with your partner allows both of you to adapt and collaboratively explore new ways to experience pleasure. Seeking medical advice from a trusted healthcare provider about potential solutions or therapies, such as pelvic floor exercises, hormone replacement therapy, or appropriate medication, can also be profoundly beneficial. Furthermore, if emotional barriers or past traumas are affecting your sexual well-being, working together with a professional therapist who specializes in sexual health can provide invaluable support. Whether it's addressing long-standing fears or navigating anxieties about changing bodies due to aging, a trained professional can offer effective strategies to overcome obstacles and boost confidence. Ultimately, fostering an open dialogue with your partner about sexual health, emotional concerns, and physical preferences not only strengthens intimacy, but also cultivates trust and mutual respect. By prioritizing sexual health through thoughtful communication, older adults can continue to experience a fulfilling and deeply satisfying sex life that gracefully adapts and beautifully evolves with age. As we journey through the chapters of life, our physical capabilities naturally evolve, and this often necessitates a thoughtful shift in how we experience and joyfully embrace sexual pleasure. What once flowed effortlessly in our youth may now require some adjustments and a dash more creativity, yet this very evolution simultaneously unlocks exciting new opportunities for profound exploration and a deeper, more intimate self-awareness. Embracing and enthusiastically experimenting with new techniques can be incredibly enriching, especially when it comes to the deeply personal realm of solo sexual pleasure. One of the key changes that gently unfolds with age is a difference in skin elasticity and natural lubrication levels. This is particularly relevant for women navigating menopause or postmenopause, where significant hormonal shifts can lead to vaginal dryness, and for men, where skin sensitivity may subtly fluctuate. The conscious use of high-quality lubricants can be truly transformative, effectively reducing friction and enhancing overall comfort significantly. There are now numerous lubricant options available, including water-based, silicone-based, and oil-based varieties, each offering unique sensations. Water-based lubricants are often gentle on the skin and easy to clean, while silicone-based options provide a longer-lasting glide. Taking the time to try different kinds can make the experience smoother, far more pleasurable, and even introduce delightful new dimensions to sensation. Moreover, the thoughtful introduction of various sex toys, many specifically designed with the comfort and unique needs of older adults in mind, can revolutionize the self-pleasure experience. These thoughtfully crafted toys are designed to accommodate shifting physical needs, featuring ergonomically friendly designs and easy-to-handle features. Vibrators, for instance, come in a wide array of styles, from gentle external stimulators to more intense body-shaking devices, allowing for precise customization based on what feels supremely best in any given moment. Some toys even focus on providing dual stimulation, expertly targeting multiple erogenous zones simultaneously, thereby greatly enhancing pleasure and sexual satisfaction. For those contending with issues like arthritis or reduced grip strength, sex toys with built-in ergonomic handles and wonderfully simple controls can make a significant and positive difference. Features like remote controls or discrete wearable options ensure enhanced accessibility and ease of use. Additionally, playfully experimenting with temperature play or varied textured surfaces can bring about delightful and surprising new sensations. The entire process of exploring and deeply understanding what feels truly good to your unique body in this vibrant phase of life can be a beautiful, empowering journey that genuinely invites a profound reconnection with your own desires. Incorporating sensual rituals such as meticulously setting the mood with soft, inviting lighting, calming and soothing music, or delicately scented candles can also dramatically heighten the overall experience. Gently slowing down and consciously being present in each moment may not only deepen the pleasure but also foster a stronger, more harmonious mind-body connection. Remember, sexual well-being is an integral and precious part of our overall quality of life, and there is immense, undeniable value in investing time and tender care into discovering new, empowering ways to experience joy and profound satisfaction. Taking the crucial step to consult with a healthcare provider about any aspect of sexual health, including any concerns or questions related to masturbation, can be both profoundly reassuring and incredibly enlightening. Medical professionals possess the specialized expertise to offer personalized, evidence-based guidance precisely tailored to an individual's unique health needs and specific lifestyle. During a consultation, a doctor can expertly address specific medical issues that may be associated with sexual activity, such as pain, discomfort, or psychological concerns, and provide comprehensive recommendations to promote safe and healthy practices. They can also thoroughly discuss how certain health conditions, medications, or specific lifestyle factors could influence your overall sexual well-being. It is immensely important to approach sexual health as a truly significant component of overall wellness, akin to the importance of physical fitness, mental health, and nutrition. An open, honest, and unreserved conversation with a healthcare provider can brilliantly shed light on myths and persistent misconceptions, offering profound clarity on what is genuinely considered normal or healthy. Additionally, doctors can assess whether an individual's sexual behaviors might be impacting other crucial areas of life, such as emotional stability, relationships, or daily functioning, and can suggest practical strategies for maintaining a balanced and healthy approach to sexual well-being. Seeking professional advice is especially crucial when there are persistent worries or when sexual health is negatively affecting one's overall quality of life. Healthcare providers can also skillfully guide patients towards specialized resources, such as counseling or support groups, if and when needed. Always remember that healthcare settings are inherently safe and confidential environments, specifically designed to support your well-being without judgment. Taking the initiative to discuss sexual health openly and proactively can lead to a deeper, more profound understanding of one's body and undeniably contribute to a more fulfilling and healthy life overall. As we gracefully journey through life, it's profoundly important to understand that sexuality remains a vital and enduring part of our identity, regardless of our age. For many individuals in their 70s, 80s, and even beyond, the inherent desire for sexual pleasure often remains strong and can significantly contribute to their overall well-being and profound happiness. Acknowledging and embracing this deeply personal aspect of yourself can lead to a richer, more fulfilling experience rooted in self-acceptance, unwavering confidence, and undeniable joy. Many older adults discover that prioritizing their sexual health brings a renewed sense of vitality and a stronger connection to their bodies. This can beautifully include exploring physical intimacy in various forms, whether through self-pleasure, such as masturbation, or shared with a partner. Sexuality in later years often takes on new meanings, evolving to become more focused on the quality and depth of the experience rather than the often performance-driven expectations that typically characterize younger adulthood. With age frequently comes the liberating freedom to explore and redefine sexual expression in ways that feel authentically genuine and deeply satisfying. It's also critically important to approach sexual health holistically. As our bodies naturally change with age, it's essential to be mindful of these transitions and make adjustments as needed to ensure comfort and maximum enjoyment. For instance, hormonal shifts can lead to changes in sexual function, such as vaginal dryness in women or erectile challenges in men. These experiences are common, manageable, and thankfully, there are many supportive resources available, from various lubricants and effective medical treatments to beneficial pelvic floor exercises and compassionate counseling, all of which can help maintain a satisfying and truly pleasurable sex life. For some, embracing their sexuality at an older age also involves courageously exploring new avenues of intimacy. This might mean trying different forms of physical connection, experimenting with novel sensations, or deepening emotional bonds with their partner. Open communication plays an absolutely crucial role here, as sharing needs, desires, and boundaries fosters profound trust and mutual understanding. Partners who communicate honestly about their changing bodies and evolving preferences often find their intimate experiences beautifully enriched by this deeper level of mutual respect and awareness. Moreover, self-pleasure or masturbation continues to be a healthy, natural, and normal aspect of sexuality throughout one's entire life. It can serve as a valuable source of stress relief, improve sleep quality, boost self-esteem, and help maintain healthy sexual function. Embracing self-pleasure without shame and with an open spirit of curiosity can lead to a more empowered relationship with your body. Many people joyfully discover that taking the dedicated time to learn what truly feels pleasurable and enjoyable leads to a greater sense of self-awareness and confident ease. In addition to physical pleasure, sexuality in later life can also profoundly nurture emotional and psychological well-being. Intimacy frequently fosters a powerful sense of connection and belonging, reminding us that our innate need for touch and closeness is both fundamentally human and deeply profound. For those who are single, widowed, or navigating the complexities of new relationships, it's equally important to honor your desires while being attentive to emotional readiness and safety. In conclusion, while masturbation and sexual activity in older age can indeed come with their unique set of challenges, they steadfastly remain a natural, beneficial, and deeply fulfilling part of life. By comprehensively understanding the implications of aging on sexual health, staying open to change, and diligently prioritizing communication and overall wellness, older adults can undoubtedly experience a deeply satisfying and immensely enjoyable sexual journey. Embracing this vibrant aspect of yourself can lead to a more enriched and empowered quality of life, filled with precious moments of passion, profound connection, and boundless self-love. Thank you for joining us in this truly important conversation about sexual health and aging. We genuinely hope that you've gained valuable insights into how our bodies and emotions evolve and how we can continue to embrace our sexuality in fulfilling and meaningful ways even in our later years. What meaningful lessons have resonated with you so far? We would genuinely love to hear from you. Please share one thing you've learned today and how you plan to integrate it into practice in your own life. Your experiences and thoughtful insights could beautifully inspire and support others in our community who may be navigating similar challenges. We truly appreciate your engagement and continued support as we strive to create more valuable content like this.